Hi, my name is Bal Dhinsa. People call me Bal for short. I'm a trauma and orthopaedic surgeon and I subspecialise in foot and ankle surgery. I grew up in the southeast of England in Kent. I trained in London and I've had to travel during my time, but my base has always been in Kent, and I now work around Kent and southeast London. Initially, I did medicine because I had the grace to it and everyone suggested that would be a good pathway for me to go. I wasn't convinced initially with all the lectures and a lot of sitting in rooms. However, when it came to the clinical years, when we see patients, I really enjoyed it. And I knew then I'd made the right choice. I enjoyed speaking to patients, I enjoyed examining them, and I enjoyed coming up with a management plan. Regards to going towards a surgical specialty, in particular trauma orthopedics, I really enjoyed the hands-on approach, the identifying of a problem and knowing how to deal with it and being able to deal with it and say you've done your best to try and improve them without having to wait for prolonged periods of time. And I really enjoyed this aspect of surgery. I enjoy the variability of foot and ankle surgery, not just in the pathology, because whether it could be arthritic or sports-related injury, or it could be an endocrinological problem, a metabolic problem, but also enjoy the fact that it could be from someone that's old, someone that's young, sometimes in the Middle Ages. And this variability I quite enjoy. I also like the fact there's a lot of innovation in foot and ankle surgery recently, not just regards to implants, but different techniques, as well as the role of regenerative medicine. And this is quite an interesting and exciting field at this time. I find most rewarding about this job is the patient outcomes. This doesn't necessarily mean surgical, sometimes it's non-surgical management that's helped. But I find the fact I can get the patients back on their feet, back to function, and doing the things they want to do rewarding. So sometimes it's just a matter of getting them out of pain and doing simple measures to make sure that they're pain-free. And just seeing the patients come towards the end of their pathway, saying that it's made a difference, is the most rewarding part. I think, regards to myself, the feedback I get from the patients is that the fact I take time with them, I allow them to discuss what's going on, and they don't feel rushed. Often they've come to me having waited a long time to get through the system, to get an appointment, and they feel frustrated, and that's why they've come to see me. I think it's important to listen to the patient and deal with the whole person, not just the condition, as often there's something else that's underlying as foot and ankle pathology. We need to make sure we address that and not just what we can see straight away. I value their honesty and also their ability for them to understand what can achieve and not be achieved, and really take on board what I've said. And that's why it's important to have a proper consultation in regards to discussing what's happened to them, how it's affecting them, and also what they expect to get out of the consultation at the end of the management pathway. Because once we've got a common ground, we can really work together and work as a team to achieve our goals. The changes of my subspecialisation really is the degree of innovation. There's a lot of new technology, new techniques. However, often a lot of these don't have the evidence to back them up, but people are trying them because they're new and in vogue. I think it's really important to use evidence-based medicine, and therefore you need to look at the literature, look at the results, and if you want to try a new technique, do it as part of a research portfolio or as a trial, so that all the evidence is collated and everyone's doing it in the same way, so you can get meaningful results. And so it's really important to use techniques that have evidence to back them up. I cope with stressful situations and difficult situations by talking. I find talking quite cathartic, and I think really talking to people around you in your close vicinity, or maybe later on in the day to some of your close friends and your network of colleagues, can be really helpful. And this is something I've developed over time, and I've realised it helps me a great deal. I would say innovation, goal-based and dynamic.